My name's HEDLEY and I'm the Locality Manager for Blyth Valley Children's Centres. We've been focusing in on the families and the children that we feel require more intensive support. It's not just about reaching and getting them registered with the Children's Centre, it's about them being engaged in activities that are meaningful. And we've identified 4 main target groups that we would specifically target. We've chosen children with disabilities or special educational needs as a target group based on an understanding through our colleagues in health and schools about the number of children who in a preschool age range are emerging as having a need, or it may be that a child comes into our centre with a known diagnosis or a disability. The family build up trust with our staff, build up the relationship so we can help get services around that family, and that we can hand over information at transition into school. So we know that there's a lot of children and families out there that will require our support in an inclusive way. Another target group is supporting teen parents, a group that needs to have intensive support in the early stages of becoming a parent. We're looking at families where they have experienced domestic abuse. We've got clear understanding that there's high level of need in our locality through our contact with children's services. And also we need to target very much into the wards which has got the highest level of deprivation. We have actually increased the reach in the last year to children living in the poorest wards from 60% to 70%. Obviously we're aiming for 100%. We have systems in place to evidence the impact of our work and working in a much smarter way, and I really do feel that we've reaped the benefits of that already. The systems are really embedded, and the advisory board, staff members, the management team are fully up to date with information and can present that in a really confident way. At individual centre level, we have drilled down from data and obviously community feedback, partners feedback, and clear evidence bases around delivery models, set ourselves very smart targets in relation to what we hope to achieve for the families living in our community. I think we've had some fantastic achievements over the last year, and some of the statistical information shows that really. We've achieved many of our targets set within the Ofsted Action Plan to timescale. That's with the support of key partners from the local authority and health. Within a community, we serve 4,500 0 to 4-year-olds. And I think the context in which we work within Blyth Valley has been extremely tough. The challenges that we have in relation to engaging the most vulnerable, and I think we do a fantastic job alongside partners in doing that. Our centres are busy. Our staff remain motivated. The services are and continue to provide quality, and we will continue to improve and refine based on a good rationale. And we have to work with the families and the communities to enable them to understand why we have to do things in the way that we have to do. We will stick by families, and we will make sure that we'll try our very best going forward.
Audio clicks. Be heard.